New for you tonight, the opioid crisis is devastating our communities.
They're not here, so you've got to fight for those that are still here.
Now there's a big push to raise awareness and get people into treatment. Good evening, everybody. Thanks for joining us tonight. I'm Mark Zinni.
And I'm Erin Connolly. Lawmakers are considering one bill initiated by a mother who lost her son. Chief Capitol reporter Susan Raff is live at the Legislative Office building with more.
There is one opioid bill, but we're told there are many different components to it, all in an effort to save lives and prevent addiction. A Guilford mother feels that if some of this were in effect when her son was alive, he might still be today.
His freshman year in high school, he was in the locker room right before his very first game. He was a starting center, and an upperclassman tossed him a little white pill and said, "Here, take this."
5 years after her son Nick died from an overdose, Sue Kruzak has not given up the fight to save others. Nick was a star hockey player. His life ended at 20.
Apparently, he never skated a game sober.
Nick was able to graduate, then started college at Southern Connecticut State University, but he was struggling with addiction. He overdosed.
Overdosed in Yale. He was actually visiting a friend, revived, and was able to get up, walk out. We had no idea any of this was going on, and he died that night.
Sue has worked with lawmakers on a bill to require those who overdose to be taken to a hospital and held up to 72 hours. Families would also need to be contacted.
There's not a single person I can imagine in this state that doesn't have a family, friend, a colleague, or coworker who hasn't been impacted by opioid use.
The Department of Public Health is launching a new social media campaign. There will also be an app with information about addiction and where to get help. Opioid deaths are alarming. Nationally, in 2017, there were 70,000 overdoses. Last year here in Connecticut, nearly 1,000 people lost their lives.
And we got to do more here in Connecticut. Let's be blunt about this. Connecticut was ground zero in the opioid epidemic. A lot of this stuff was designed here in Connecticut.
If people can get to a hospital, the road to recovery can start sooner.
He is, the force behind this. And, what else do you do? The love of your children, right?
There is something that we hear time and time again when we do opioid stories, and that is there is a lack of beds here in Connecticut, and that is an issue, and that is something that needs to be worked on, although there are outpatient treatment facilities. As for this bill, we are told that the Public Health Committee has passed it, and the hope is that it gets passed in the House and then the Senate. We're live in Hartford. Susan Raff, Channel 3 Eyewitness News.